Amanda from Straight Smile Solutions, straightsmilesolutions.com, and today we're going to talk about underbites, what we in the world of orthodontics call negative overjet. And this is just part of a series of informational videos to not only parents who want to learn a little bit more about malocclusion and bites and how to prevent things from happening to their child, but also to dentists who are interested in treating their patients more effectively and efficiently. Please do go to straightsmilesolutions.com and continue to submit your questions and inquiries so I can help you. Remember, this is not a substitute for medical advice for your child. You should talk to your own pediatrician, your own pediatric dentist, your own orthodontist, or your own family dentist about your questions. But if your doctor has any questions, they're welcome to visit the site to educate themselves. So let's talk about underbites. Again, we call these negative overjet. This is where the top teeth or crossbites come behind the lower teeth. It really should be the opposite way. So you can see on this child here how the bottom teeth are ahead of the top teeth. This is not a healthy bite. What can happen? And why does this happen? Well, first of all, it could be genetic. So sometimes this is just a familial condition. If you're seeing it at a young age, it is something that often can be completely corrected and will completely go away. But you need to correct these as early as possible. You can even start correcting them in the primary dentition. Yes, when the child's in the still in the baby teeth stage, because you need your dentist or orthodontist to find out if this problem is just related to the teeth coming in at different angles than is ideal, or if the jaws are growing mismatched. And if the jaws, either way, it needs to be corrected because the teeth are not going to wear properly. And the jaws aren't going to grow right if this kind of bite is happening. So do make sure that you are finding a dentist or an orthodontist who knows how to correct this and believes and agrees to that it's best to correct it at an early age, not wait till the child is 12 and old enough for braces. Why? Because this may involve changing the position of the jaws, encouraging a jaw to grow more, encouraging a jaw to move forward or to advance to match up with the other one. And if you're trying to encourage growth, we call this growth modification. This has to happen while the child is still growing. So that means we need to know a little bit about what stage of growth, skeletal growth, their body growth, the child is in. Now, sometimes the stage of the skeletal growth or the body growth is different than the stage of the dental growth of the child. So you can have a 12-year-old female child who is done growing skeletally for years. Their bones are done, which means you lose the opportunity to encourage something to grow more, right? But they may still have baby teeth, and that's how that happens. You have a skeletal age and you have a dental age, and you could be way off. You could have a dental age of 12 and a skeletal age of 15. You know what I mean? So it could be a mismatch. So in any case, hopefully you get the idea that this is not a healthy situation. It can affect not only the long-term bite, the jaw joints. It can affect actually the child's airway and ability to breathe and sleep properly if the upper jaw is part of the problem, if it's behind, if it's impinging the airway, if it's affecting the ability for the air to come through the nose, because the nose is related to the upper jaw. It could be very dangerous. So we need you, as soon as you see this in your child, to go to a dentist and orthodontist who is going to make a change at an early age. Any questions, or if you're looking for a dentist or orthodontist who believes in this, if you're getting a no for an answer and you're seeing this, you should move on. You can ask your dentist or orthodontist, maybe they're not educated. If they'd like to learn more, they're welcome to connect with me. I will talk to every single dentist or orthodontist in the whole world if they have questions and they want to learn something, and teach them about different options to help their patients. But if that dentist or orthodontist is obstinate, if they're stubborn and they don't want to learn something and they don't think this is a problem, you need to move on. You need to move on to somebody who believes in the health of the child, who believes that early growth modification is necessary, and I can help you find that doctor. So just let me know. It doesn't matter where you live, because the health of these children is really important to me. Why? Because I will see patients in my practice who are 12, 13, 14, 15, who permanently now have this bite, who have severe discomfort, severe pain, who are having troubles eating that sandwiches, who are having troubles with their airway, who are having troubles with their sleep, who are having troubles as a result of all this just with their general life because they're not feeling good. Their health condition isn't good. And then what? I have to do a jaw surgery on this patient. I have to work with an orthodontic surgeon to cut this child's jaw and move it in a way so that the jaws match up. It is a dangerous procedure, and there can be fatalities from this procedure. And who wants this? Not to mention the price of this procedure when the child's 17, 18, when this can be corrected often at a very, very young age for a very small price. So anyways, that's just my lesson for you today. StraightSmileSolutions.com. Hopefully you learned something. Have a great day.